14 health symptoms men should never ignore. Hey everyone, welcome back to the channel. Today, we're diving into an important topic that every man should be aware of. We're talking about 14 health symptoms that you should never ignore. Your health is your most valuable asset, guys, so let's make sure you're taking care of it. Let's get started. Alright guys, let's kick things off with a symptom that should never be taken lightly: chest pain. It's one of those signs that can indicate a range of issues, from minor to life-threatening. While chest pain can be a sign of a heart problem, it can also be caused by muscle strain, heartburn, or anxiety. Each of these conditions presents differently, but they all share that common symptom of chest pain. When it comes to chest pain, especially if it's accompanied by shortness of breath, sweating, nausea, or pain radiating down your arm, seek medical attention immediately. These additional symptoms can be indicators of a more serious condition, such as a heart attack. Don't wait. Call 911 or get yourself to the nearest emergency room. Quick action can make a significant difference in the outcome. Time is muscle when it comes to your heart, and the sooner you get help, the better the outcome. Every minute counts, and delaying can lead to more damage. Even if it turns out to be something less serious, it's always better to err on the side of caution. Remember, it's your health, and taking prompt action can save your life. Next up, we're tackling shortness of breath, also known as dyspnea. This is a condition where you feel like you can't get enough air into your lungs. This is another symptom that you should never ignore, especially if it comes on suddenly or is severe. It can be alarming and may indicate a serious underlying issue. Shortness of breath can be a sign of a range of problems, from something as simple as a cold or allergies, to more serious conditions like heart disease, lung problems, or even chronic obstructive pulmonary disease, COPD. It could also be a sign of a blood clot in the lungs, known as a pulmonary embolism, which is a medical emergency. If you're struggling to breathe, it means your body isn't getting the oxygen it needs to function properly. This can lead to feelings of dizziness, fatigue, and even confusion. If you find yourself short of breath doing everyday activities like walking upstairs or carrying groceries, or if it's accompanied by other symptoms such as chest pain, wheezing, or a tight feeling in your chest, or a bluish tint to your lips or fingertips which indicates a lack of oxygen in your blood, get it checked out by a doctor immediately. Don't ignore it, guys. Your health is too important to take chances with. Okay guys, let's talk about unexplained weight loss. Losing a significant amount of weight without any changes to your diet or exercise routine can be a sign of an underlying health problem. We're talking about losing 5% or more of your body weight over 6 to 12 months without any explanation. This could be a sign of issues like hyperthyroidism, diabetes, celiac disease, or even certain types of cancer. If you notice a significant drop on the scale without any effort, schedule a visit with your doctor to rule out any potential medical conditions. Here's one that I know a lot of people can relate to: persistent fatigue. We live in a busy world and it's easy to feel tired or run down from time to time. But if you're constantly feeling exhausted, even after a good night's sleep, it's important to pay attention to your body. Persistent fatigue can be a symptom of a wide range of health issues, including sleep disorders, nutritional deficiencies, mental health conditions, thyroid problems, and heart disease. Ignoring chronic fatigue can mask underlying conditions that need attention. Make an appointment with your doctor to discuss your symptoms and get to the root of the problem. Let's move on to a symptom that might make some guys uncomfortable to talk about: blood in your urine, also known as hematuria. This can be a startling discovery and may cause immediate concern. While it's not always a sign of a serious problem, it can sometimes be a warning sign of underlying health issues. It's definitely something you should never ignore. Ignoring it could lead to more severe health complications down the line. Blood in your urine can be caused by factors like strenuous exercise, dehydration, urinary tract infection, kidney stones, an enlarged prostate, or even bladder or kidney cancer. Each of these conditions requires different treatments and approaches. The color of the blood can also provide clues about the underlying cause. For instance, bright red blood might indicate a different issue than dark brown blood. If you notice any blood in your urine, no matter how minor it seems, even if it's just a small amount or it goes away on its own, it's crucial to take it seriously. Get checked out by a healthcare professional. Early detection can make a significant difference in treatment outcomes. Don't take chances with your health. Always consult a doctor if you notice blood in your urine. Next up, let's talk about a topic that can be a little sensitive: erectile dysfunction, or ED. While occasional difficulty achieving or maintaining an erection is normal, experiencing it frequently can be a red flag for issues like cardiovascular disease, diabetes, high blood pressure, high cholesterol, obesity, hormonal imbalances, stress, anxiety, or depression. The good news is that ED is often treatable, and addressing the underlying cause can significantly improve your sexual health and overall well-being. So guys, if you're struggling with ED, don't suffer in silence. Seek help and improve your quality of life. Now let's talk about changes in bowel habits. If you notice significant or persistent changes in your bowel movements, it's important to pay attention. These changes could be a sign of digestive issues like irritable bowel syndrome, Crohn's disease, ulcerative colitis, infections, hemorrhoids, or even colon cancer. Let's address a symptom that might seem pretty common: a persistent cough. If you have a cough that lingers for more than a few weeks, especially if it's accompanied by other symptoms, get it checked out. A persistent cough could be a sign of underlying conditions like postnasal drip, GERD, asthma, allergies, bronchitis, pneumonia, or even lung cancer. In some cases, a persistent cough could be a side effect of certain medications. Pay attention to the characteristics of your cough. Is it dry or productive? Is it worse at night or during certain activities? Let's talk about severe headaches. If you experience sudden, severe headaches that are different from any you've had before, or if they're accompanied by other symptoms, seek medical attention immediately. A severe headache could be a sign of a serious condition like a stroke, meningitis, a brain aneurysm, or extremely high blood pressure. Pay attention to any accompanying symptoms, such as fever, stiff neck, confusion, weakness, numbness, vision changes, speech difficulties, or seizures. Next up, let's focus on a sense that's often taken for granted: vision. Sudden or gradual vision changes, such as blurred vision, double vision, seeing flashes of light, floaters, halos around lights, or loss of peripheral vision, can be a sign of eye conditions or underlying health problems. Some potential causes include refractive errors, age-related macular degeneration, cataracts, glaucoma, diabetic retinopathy, eye infections, migraines, strokes, or brain tumors. Let's discuss a symptom that can often cause anxiety lumps or swelling. Most lumps and bumps are benign, meaning they're non-cancerous and harmless. However, it's always best to get any new or unusual lumps or swelling checked out by a healthcare professional, especially if they're persistent, growing, or causing you pain. Lumps and swelling can occur for a variety of reasons, including injuries, infections, cysts, hernias, swollen lymph nodes, or in some cases, cancer. Your skin is your body's largest organ, and it's often a reflection of your overall health. Pay attention to any changes in your skin, as they could be a sign of an underlying medical condition. Skin changes can be caused by factors like allergies, infections, autoimmune disorders, hormonal imbalances, sun damage, or even skin cancer. Let's address a topic that's often stigmatized but incredibly important: depression and mood changes. If you're experiencing persistent feelings of sadness, hopelessness, loss of interest in activities, changes in sleep or appetite, difficulty concentrating, fatigue, irritability, or thoughts of self-harm, seek professional help. Depression and mood changes can stem from factors like genetics, chemical imbalances, stressful life events, chronic illnesses, or certain medications. Finally, let's talk about a common symptom: persistent fever. If you have a fever that lasts for more than a few days or is accompanied by other concerning symptoms, see a doctor to determine the underlying cause. A persistent fever could be a sign of a viral infection, bacterial infection, urinary tract infection, ear infection, sinus infection, or other inflammatory conditions. Thanks for watching. If you found this video helpful, make sure to give it a thumbs up and share it with your friends. Remember guys, knowledge is power, and being proactive about your health is one of the best things you can do for yourself and your loved ones. Don't ignore these potentially serious symptoms. Early detection and treatment are often key to better outcomes. If you're experiencing any of the symptoms we discussed, please don't hesitate to reach out to a healthcare professional.